The COVID unit is a pretty tightly run collection of people, and it's a microcosm of what goes on everywhere in a hospital. It involves the care of a whole slew of people, and the closest, most continuous care is obviously that by the nurses. And far and away, they have it the toughest. You know, standing in hot PPE for 10 to 12 hours a day is draining, and the chronicity of the disease in some people can be exhausting. I've yet to hear anyone complain down there. And they show up, they do their job, they do it willingly, they're emotionally involved. The people involved there are extremely dedicated and want to be there and want to do this. And I think they feel this is a kind of a higher calling for them.
We're here to help, not just do a job, but here to help patients get through what they have to get through so they can feel better, and Halifax Health has helped us in doing that in a lot of ways.
I don't think anyone finds it scary in there. The comment I hear the most often is that this is what we were trained to do, and we enjoy doing it. We get extremely closely attached to these patients. It's hard not to. The patients that are in there for 2, 3, 4 weeks, we know them, we know their families through FaceTime and so forth, and that can be emotionally draining.
I've been nursing for many years, but I'm going to let you know that this virus doesn't pick and choose. It just does what it does. Brothers down there together, one will come out, one will not. How do we tell them? How do we work with them? It's a whole new opening to nursing care and to life, and I have to applaud these nurses because the support we have and how they work together is just fabulous.
It's a very, very small percentage of patients that actually usually end up in our biocontainment unit and who require more advanced care. Of those who come into the biocontainment unit, a large percentage of them require nothing more than a little supplemental oxygen for a few days. They receive intravenous steroids and antiviral medication, and usually are able to be on their way. Some of the patients receive convalescent plasma early on in the course of the infection. But I do need to emphasize that it's actually a very small percentage of patients that end up on a ventilator. Someone doesn't do poorly because we put them on a ventilator. We put them on a ventilator because they were doing quite poorly and there was no choice. But I'd like to emphasize one more time that the vast majority of people who get this illness are going to be all right and are going to do well.
When patients leave, we all clap. And everybody has tears in their eyes. I mean, it actually gets me a little bit to know that these people have made it through, and we've tried our best and we don't lose everybody. Thank you.